After studying this module, you would be able to learn about the key concepts of the cognitive behavioral paradigm, understand the counseling process of the cognitive behavioral approach, examine the counseling techniques and procedures involved, and evaluate the limitations and criticisms of cognitive behavioral counseling. Introduction. Cognitive behavior therapy or CBT or counseling, which combines principles associated with information processing and learning theories, is relatively a young but quickly developing area of clinical psychology. A basic assumption of CBT or counseling is the recognition that there is a reciprocal relationship between clients' cognitive processes, that is what they think, and their affect, that is emotional experience, physiology and behavior. This emphasis on cognitive processes represents a shift from stimulus response and drive models to the dynamics of systems and subsystems of thought, based on the notions that thinking plays a role in the etiology and maintenance of at least some problems. These interventions overall aim to reduce distress and enhance adaptive coping by changing maladaptive beliefs and providing new information processing skills. Though cognitive behavioral interventions for individual disorder differs in their form and application, all of them apply the same underlying principle. CBT or counseling may accurately be curative, that is, there is evidence that CBT can reduce risks so that clients need not to stay in treatment forever, or that problem can actually be prevented. The counselor does not force ideas upon the clients but rather attempt to provide him or her with graded tasks or homework assignments in order to instill new ways of thinking, and thereby through instructions and modeling attempts to alter negative thought patterns with more adaptive ones.
The primary assumption that underlie all the behaviors under the domain of cognitive behavioral counseling is that cognitive variables are the important causal and maintaining mechanisms in the onset of a dysfunction. However, the affective and behavioral variables are interrelated and contributing as well. Characteristics of intervention procedures. Ingram presented following basic characteristics that underline the therapeutic procedure falling under the realm of cognitive behavior counseling. First, causal and maintaining roles of cognitive processes holds primary importance. Second, it uses some of the therapeutic procedures that are aimed at altering cognitive aspects. Third, in-depth exploration of cognitive, affective, and behavioral aspects that are maintaining the problem. Fourth, both cognitive and behavioral techniques can be used to target cognitive objectives. Fifth, empirical verification in research assessment and treatment is emphasized. Sixth, is time limited. Seventh, a collaborative relationship between counselor client is promoted. And eighth, active participation from both the parties is demanded. Collaborative empiricism. The process of CBC entails a particular style of interaction or therapeutic relationship known as collaborative empiricism, whereby the help of the collaborative and task-oriented alliance, a counselor tries to create an atmosphere where resistance is at its minimal. Faith and confidence in disclosure of sensitive experience is high and is conducive enough in helping client reach his or her maximum potential. Both of them work together actively in identification of problems, designing and execution of specific hypotheses and behavioral experiments, and eventually reanalysis and restructuring of their belief systems. The counselor creatively blends empathy with active and problem oriented focus to further strengthen the working rapport with the client. Main tool used to maintain this active focus is known as Socratic questioning, where questions are used rather than assertions to uncover the illogical or inconsistent quality of another person's position. As the counseling progresses, the client himself or herself becomes aware and develops skills to unfold and critically evaluate his or her own ideas, beliefs, and resulting behavior. Modification of valence. A second therapeutic pathway considers changing the valence of clients' self talk. In a study of counseling of youth with anxiety problems, negative self talk was found to play a role in both predicting anxiety and mediating interventions gain. It was hypothesized that negative self talk, as opposed to positive self talk, is predictive of maladjustments. The result indicated that higher functioning was linked to fewer negative self statements but not to greater positive self talk. Moreover, as clients reduced their distress, the accompanying negative self talk became less frequent, which was in turn found to mediate gains from CBC. Techniques used. Techniques used by CBT oriented counselors are a creative combination of both cognitive and behavioral strategies which are customized for each single client. The behavioral techniques of CBT are designed to express the connection between mood and behavior as well as to provide an opportunity to develop new skills by giving opportunities for practice trials. On the other hand, the cognitive techniques, for example, cognitive restructuring, problem solving, is designed to teach the skill to identify, reevaluate, and replace maladaptive thoughts, whereas certain techniques draw from both the principles as they emphasize the connections between thoughts, affect, and actions. Affective education. Affective education basically helps the client to recognize, label, and self monitor physiological and emotional cues and thereby to alter or control behavioral reaction that instigate these cues. It aims at enabling client to gain a greater understanding of his or her outward manifestations of emotions to become aware of the situations that trigger them and hence make it difficult to deal with them. Relaxation training. Relaxation procedure is an example of affective education wherein the objective is to teach the client to manage their physiological arousal to emotionally stressful situations using relaxation procedures, thereby making them process information in a more reasoned and less dysfunctional manner. Social problem solving. In this process, the client is self directed, conscious, and effortful manner works to find adaptive ways of coping with everyday situations that are considered stressful. It consists of two major processes. First, problem orientation, which is defined as the schemas one holds about problems in everyday life and one's assessment of their ability to solve said problems. Problem solving process is the second major process which encompasses the skills and techniques one uses to search for solutions and applying these skills to find the best solution available. Cognitive restructuring, attribution, retraining consists of strategies aimed at altering cognitive distortions. The client is taught to identify and dispute irrational or maladaptive thoughts, such as all or none phenomena, magical thinking, emotional reasoning, etc. Using techniques such as Socratic questioning or guided imagery, it can be used for teaching skills to overcome cognitive deficiency as well. Attribution retraining is similar in that it teaches the client to be aware of the nature of their attribution for positive and negative outcomes. Reinforcement. It can be used as either a method for motivating behavioral activity and teaching cognitive flexibility, For example, rewarding a child for greeting and exhibiting good manners in front of guests, or as a way of suppressing behavioral activity, for example, punishing a child for missing school regularly. Modeling and role plays. These two techniques require counselor to demonstrate to the client as to how to analyze and evaluate affect, cognition, and behavior. In modeling, the counselor models the behavior appropriate to a given situation, and in role playing, both the client and the counselor actively take part to enact a given situation, and thereby to understand adaptive ways of reacting to the same. Training workbooks consist of practice sessions and homework assignments a client undertakes in order to learn and master new skills learned. Structure of counseling. Broadly, CBC can be subdivided into two intermingling parts, one of which deals with psychoeducation and the other one deals with practicing of skills learned. Both the parts go hand in hand, often occurring simultaneously. In the first part, the client is educated about the characteristics of his or her problem, etiology, prognosis, management. A case formulation is prepared on the basis of detailed interviewing and assessments, which provide a blueprint of how did the problem took its shape. This helps the client as well as the counselor understand the areas which require management and also deciding upon the most effective ways in which they can be managed. The second aspect deals with providing the client with opportunities in which he or she can practice the management skills learned in the process to deal effectively with these identified dysfunctions and thereby gradually learn to generalize them. However, an important point to remember here is that the counselor should be sensitive enough to provide the client with enough diverse opportunities so that he or she not caught off guard in a novel situation as well as should be able to generalize comfortably and effectively over new situations which were not covered during the counseling session. Initiating the therapeutic process. The very first interview has an important role in beginning the process of counseling, whereby the counselor initiates to establish a working rapport with the client, which will be the base of entire therapy. Having developed a sound working rapport is very important to sail smoothly in the entire process. Else, alliance will face a lot of resistance which may hamper or even result in failure or dropout. In the initial few sessions, clients usually present undifferentiated array of difficulties and the counselor with the help of detailed casework attempts to structure and develop a case formulation. Here, a detailed case workup of the client is very crucial as this will provide an important insight into the problems faced by the client. Any information missed or misinterpreted may later result in serious consequences. Following the case formulation, the counselor decides upon the assessment procedures to be undertaken, which will help uncover the salient conflicts and thereby devising an intervention plan. It is also very important at the very outset to educate client about the counseling ethics, especially emphasizing on confidentiality or otherwise he or she might refrain from disclosing some crucial information which is very sensitive or perceived by him or her as embarrassing, though might be very crucial to address. Behavioral interviewing. Initial stage. Most clients have little idea about how to present the entire account of a problem in an organized and structured manner. Relevant from the point of view of counseling at present, therefore, they may provide with undifferentiated array of difficulties. The counselor should listen carefully and communicate caring concern to the client. Comments such as, I can understand how difficult it is for you at present, can express your sensitivity towards them and facilitate rapport formation. Both verbal, for example, phrases such as I understand, or nonverbal, example nodding, eye contact, can be utilized to encourage them. Some clients find it difficult to express themselves. As such instances, it may be helpful to ask questions such as, what made you upset last time? What was the first thought that came to your mind? Paraphrasing can also be efficiently utilized here to help him or her uncover further. When there is more than one presenting problem, they both should work out together to develop hierarchy in which different problems will be addressed. Development of problem. Onset describes the development of the problem over time. Was it an accurate reaction to a presenting stressor, or did it develop gradually over time? Course. The course describes the way the problem is progressing, whether it is continuous, fluctuating, deteriorating, etc. It will help us establish as to why the client presented for help at this particular time, as it may in turn reflect other difficulties. It is also important here to point out that the problem may have developed because of some other reason, which might be irrelevant now, and at present, an entirely different factor might be maintaining it. Predisposing factor. This represents the factors in background which made it more likely that the client would develop the target problem. Behavioral analysis. Behavioral analysis is aimed at discovering how the problem is currently maintained, in what ways it is interfering with the client's life, and whether the problem is serving any useful purpose or not. It can be conducted using two commonly used approaches. ABC analysis. The antecedent, behavior and belief, and consequences. Each of these factors may increase or decrease the probability that the behavior will occur. The assessments here aim to identify the factors maintaining the problem and what can be changed. Yet another straightforward way of carrying out behavioral analysis is to describe the context in which problems arise, to express factors that modulate its intensity and assesses the consequences, including avoidance of them. Detailed description of the problem. It is useful to ask the client about a detailed description of a recent example of a problem, which will provide more information than that is obtained from a general description, and thereby will be providing cues about maintaining factors. This description should include internal events such as thoughts, feelings, and physical symptoms, as well as overt behaviors. For each problem, the counselor should have a clear picture of what the problem is, when, how, often, with whom it occurs, level of associated distress, and resulting disruptive behaviors. Context and modulating variables. Behavioral theory assumes that abnormal behavior is learned and can hence be triggered by external or internal cues, which have become associated with the problem behavior. A detailed assessment of contextual triggers is required, which, as their context will be manipulated during the intervention phase. When considering context in which problems arise, 6 broad areas mentioned in the table should be highlighted. Maintaining factors. The major focus here is on the immediate consequences of the problem behavior. The most potent consequences of the problems are the client's thoughts and other reactions to the problem, as these frequently set up a series of vicious circles which maintain the problem. Immediate consequences. As with triggers, these reactions can be classified into 6 broad groupings as presented in the table. Avoidance. The avoidance of or relief from distressing emotions is frequently an immediate factor, and the counselor should therefore require an extensive description of what is avoided. Coping resources and other assets. Methods of coping with the problem situation and distress differs from individual to individual, as well as the extent to which they rely on themselves rather than on others. An assessment of this will help the counselor chart out strengths, assets, and skills one has. These include environmental features, for example, a supportive spouse, satisfying job, etc. Skills which may generally facilitate change, such as good record keeping, delicious cooking, etc. And strengths such as good sense of humor, willingness to tolerate discomfort, interpersonal warmth, etc. Previous psychiatric or medical history, intervention. A description should be obtained of any past histories related to psychiatric or medical condition, especially presence of similar episodes, client's compliance and response to previous treatments, as this will provide good information about the speed of response to the treatment as well as if there are any pitfalls which led to failure, they can be dealt with cautiously in the current intervention. Preliminary formulations. By this stage, the counselor should be in a position to give that client a preliminary formulation of the problem, which would include a brief description of the current problem, an explanation of how it developed, including predisposing, precipitating, and maintaining factors, and a summary of the strengths, assets, and skills available with the client. As the intervention plan will be based on this formulation, it is important to take patients' feedback about it. Goal setting. After the preliminary formulation has been verified by the client and intervention plan has been charted out, the next big step is to formulate specific goals for each of the problem areas which are going to be worked on, as well as setting up intermediate sub-goals. This will not only give direction to the counseling process, but at the same time provide milestones to reflect upon the journey covered so far and success achieved. Without having specific goals in mind, counseling might progress in a vague manner. It is equally important to pay attention to the structure of the goals. They should be laid down in a straightforward, simple, and positive terms, as well as should be practical enough to be achieved, else it will result in client moving away from them rather than moving towards them. Self-monitoring. It is one of the most widely used tools in behavior interviewing and is used almost invariably, both at the initial assessment stage and to monitor subsequent changes. It is flexible and can be applied to a wide range of overt and covert problems, thereby yielding information about different aspects of problems. Barlow et al. Point out that there are two stages in self-monitoring. First, note that the behavior, thought, emotion event has happened, and second, he or she has to record the event in detail. These stages should be explained to the client explicitly at the very beginning, but self-monitoring is started and care should be taken to obtain accurate measurement. A measurement procedure should be relevant to the context, should measure what it proposes to measure, valid. Information recorded should be consistent enough over the span of time, reliability, having specific, clear, and defined targets using proper aids for measurement, which are sensitive and meaningful at the same time simplistic, are some of the factors which, when kept in mind, increases the efficiency of measurement. There are several ways in which the data can be monitored, such as frequency counts, the frequency with which a given behavior is occurring, duration of a problem, self-ratings, thought diaries, etc. Reactivity of self-monitoring. Sometimes, as the patient begins to record the occurrence of a event, its frequency automatically changes. This is known as reactivity of self-monitoring. It is independent of whether or not the monitoring is accurate. One of the possibilities for this change can be that as the patient starts charting the occurrence of phenomena, this monitoring interrupts an automatic chain of behavior and allows the client to reflect back on the situation. Self-report questionnaires. Another very successful tool for collection of relevant information can be questionnaires. These can be open-ended, where the client is expected to describe his or her thoughts, perception towards the question being asked, or they can be closed-ended, in which the client has to select the alternative which best describe his or her stance. Using questionnaire, a wide spectrum of problem situations can be easily covered without missing on any relevant elements. Hence, they prove to be a good objective measure of the presenting problem. Information from others. Additional information can be obtained from key individuals such as family members, colleagues, relatives, peers, etc. in all the areas discussed so far, which will provide an unbiased description of the presenting situation, as the decisions undertaken should be based on the thorough exploration of the situation and not just one side of it. Application of intervention techniques. On the basis of all the information on the above mentioned relevant domains have been ascertained, the counselors make judgment of the techniques which can be utilized for achievement of predetermined goal. It is not necessary to use all the techniques under the domain of CBC. Instead, those which will prove to be beneficial can be selected. A hierarchy ranging from least difficult situation event faced to most difficult situation event faced is made in accordance with the predetermined goals. The tasks are arranged in an increasing order of difficulty so that mastery of tasks at lower levels of the hierarchy can give a sense of achievement and accomplishment to the client, thereby motivating them to work with more rigor in the future. Failures experienced at the initial levels owing to complexity of the task in the hand can backfire and damage the motivation levels and eventually result in a dropout. Till the time the client accurately acquires the potential to perform the skills accurately, their application should be guided well under the supervision of the counselor. But at the same time, the counselor should be sensitive enough to keep clients' dependence on him at bay, as this will prove to be a big block when the client will be expected to generalize the techniques learned. Post-intervention assessment. After the predetermined goals have been obtained in the stipulated time period, conducting a repeat assessment is always a good idea so as to ascertain the objective measures of the progress the client has made. The assessment conducted during the initial phase will provide the baseline for comparison. The positive or negative discrepancy from whom will reflect the direction of change in client's presenting problem, as well as it will help in making the decisions about termination of the counseling sessions. Termination. On the basis of the results obtained in the post-intervention assessment, the termination of counseling can be planned. Initially, the client is called for session twice a week, weekly or bi-weekly, depending upon the severity of the problem. And towards the termination phase, the frequency is reduced gradually so that dependency should not set in and termination is not sudden for a client to accept. In case the client presents concern about relapse or insufficient capacity to apply cognitive techniques without therapeutic support, these should be approached similarly to other negative thoughts dealt with during the counseling sessions. Role plays where the counselor presents worst case scenarios with accompanying negative thoughts and interpretations, and the client plays the counselor's role by guiding the problem solving process and proposing more realistic alternatives also helps in termination phase. Regular follow ups and booster sessions after a month and so on can be planned in order to keep the track of client's improvement as well as to address difficulties the client might have faced when applying the techniques learned to actual situations outside the parameters of counseling settings. Problems encountered during counseling. Several problems may be encountered, counselor or client based, although a blend of the two is most common. It is very important for the counselor to be careful not to lose the sight of the final goal while focusing energetically on the individual problem. A very important obstacle that can crop up during the counseling session is that of transference, which is a phenomena characterized by unconscious redirections of feeling from one person to another. These feelings can either be positive, for example, love, desire, etc., or can be negative, for example, anger, aggression, etc. Whatever they may be, they have the power to influence the established rapport between the counselor and the client, thereby impairing the entire association. Another problem is that of countertransference, which is defined as redirection of a counselor's feeling towards a client, or more generally, a counselor's emotional entanglement with the client. It can have similar effects as well as it might end up creating resistance or violation of professional boundaries between the client and the counselor. Poor compliance with the routine sessions, homework assignments, behavioral experiments, etc., can also be one of the influencing factors, so as the dropouts. Hence, a CBT oriented counselor should recognize these limitations and refer on clients appropriately. Training. Given the highly structured nature of cognitive behavior counseling and the prominent role of a counselor, the practitioners need to inculcate adequate capacity for genuineness, understanding, empathy, and unconditional positive regard. He or she is expected to have a sound knowledge of the cognitive model of counseling, its specific application to different problems, and its future range of techniques. However, this shall still not complete the role requirement, as delivering a session in practical is much more beyond the theoretical picture confined to the textbook, as the guideline can be the same, but each and every individual suffering from a problem is unique in itself, and no two individuals will have identical problems, though they might have similar ones. Hence, the most effective route to competence is to combine reading, observation of experienced counselors, and supervised experience, which includes training experience in conducting both individual and group sessions. Specialized training centers are set up in many countries to provide such programs. Indeed, training in CBC is now a common component of a basic program in psychology.
Now let us summarize this module. Cognitive behavioral counseling is relatively a brief, active directive and empirically based form of counseling which emphasizes collaborative problem solving by focusing its attention on how a cognitive phenomenon maintains emotional distress and self-defeating behaviors. It entails clear technical guidelines and has arguably been evaluated in a greater number of methodologically sound studies than any other form of counseling or psychotherapy.